So, this theory is about comfort and how to meet the patient's needs and the importance of making a patient comfortable during their treatment. So, part of what Catherine goes into, and one of the key things that really hit home to me, was the health seeking behaviors. So, in Catherine Kolbaka's comfort theory, she basically states that if a patient is comfortable and all their healthcare needs are being met, they're going to be more compliant with treatment and also participate in getting better, as well as a decrease in health seeking behaviors. So when I think about this, I think about my patient who is a polysubstance abuser, came in for a bilateral lower leg wound infection, which was complicated by MRSA, and so forth. So, because he's a polysubstance abuse, or he's prone to be asking for a lot of pain meds or something that makes him feel better or high. Along with this, he's got a back injury that has led him to have muscle spasms on the bilateral lower legs, and for this he does take oxycodone and a muscle relaxant. So in order to make him comfortable, we're going to decrease the health-seeking behaviors he shows to us. And the importance of this theory is that if we keep up with his pain medication as scheduled, he's going to be less likely to not ask for them on such a periodic basis and make a habit of it. We're going to keep him on this medication, keep him comfortable, but also help his pain levels decrease over time. Another thing is that he's also, during this time, because he's in so much pain, he's refusing wound care dressing changes. So on his bilateral lower legs, he's got these open wounds, which of course are complicated by MRSA, but if we don't change those dressings, his infection is going to increase. So the fact that he's in pain, he won't roll over, these muscle spasms are getting worse, he's not complying with part of his treatment plan because he's in so much pain. Catherine Kolbaka's theory focuses on how if we make him more comfortable, he's going to be more likely to be a part of his treatment plan and let us change his dressings, which in turn will help decrease the infection. And then in my concept map, if you look, there's also other types of pain control methods, such as non-pharmacological pain management, which we can try as per best practice of this hospital. You have to do a combination of pharmacological and non-pharmacological. If the non-pharmacological interventions don't work, then it's more prone to be leaning towards the pharmacological. So along with treating this patient with pain medication, we've also implemented trying to use ice packs and help to numb the sensation and help make his pain feel a little better and make him more comfortable versus asking for pain meds every 5 or every 10 minutes. He's also a very anxious patient, and that's because he's got a history of polysubstance abuse. He's always on edge. He was using heroin prior to his admission. So helping him become more calm and less anxious is also a part of our treatment care plan. So we have tried music therapy, and we've asked him, hey, what music helps you? It doesn't necessarily have to be a calm meditation type of music, but it's what the patient preference is, and showing that we care about what he wants is going to in turn make him more compliant with our treatment. So we've implemented music therapy. We also found out that part of the reason the comfort needs are not being met is because there's other intervening variables. Intervening variables are things that are unchangeable, that, we couldn't change, and we can now consider it in our treatment plan. Part of it is poor prognosis. There's a poor prognosis if the patient continues to abuse drugs. So the patient gets discharged, he goes back to using heroin, his infection's not going to get any better. Part of the fact that he is homeless. So one of our goal plans there is if you shoot down to where it says healthcare needs, you see another arrow going up to a support group. Part of our care plan was to see if he can go to like an inpatient detox center where they will also offer support group, and then hopefully something outpatient will help him continue to stay away from IV drugs. One of the most important things to make sure a patient is comfortable and that need is always being met during their stay at the hospital is to reassess the pain. So if we gave oxycodone at 9 a.m., you want to reassess it either a half hour or an hour after it was given, based on the type of way the oxycodone was given, whether it was oral or whether it was IV. So looking to follow up with the patient shows that we care about their comfort, and to make them comfortable is our goal. And then you have meditation is always helps. However, this patient did not really go along with that type of treatment plan. He was very on edge. He tried music therapy. It does work for him. However, meditation does not. And institutional integrity. So how will poor comfort ratings affect the institution's rating? So this refers to kind of the Press-Ganey award. If their comfort needs are not being met, they're not going to be happy with the way they received care at this hospital. So part of our goal is to make sure that their comfort levels are being met. Therefore, we get a good rating as far as the type of care we give to the patient. And that ensures that one of our goals is to make sure we meet their comfort needs during every single admission, during every single shift they are here. And the most important thing I take out of this is that, again, if we meet the patient's comfort needs, healthcare needs, comfortable in general, make sure there's no pain or anything like that, they're going to be more likely to work with you as the patient and to nurse relationship and let us continue to take care of him, but also talk to the patient and convince them and educate them about what they need to do after their discharge. And they're more prone to understand what we're saying when they're not in pain. I mean, you can imagine yourself, if you sprained your ankle, you're in the hospital, it hurts so bad. Are you going to be focusing on the pain, or are you going to be focusing to what the nurse or the doctor has to say about icing it, stretching it, and so forth? You're not gonna. It's gonna go in through one ear, out the other, or it's just gonna be a blur. But if the doctors did medicate me and my pain was gone, I'm more likely to hear what they're saying and also understand it. So Catherine Kolbaka's theory, comfort theory, is really important to nursing because it will help us educate, take care of patients, but also facilitate the aftercare discharge instructions as well. And this will also help prevent patients from coming back to us for readmissions. So this is why I chose the Catherine Kolbaka's comfort theory.